Hi, I'm Ann Lewis. I'm at the Oregon Regional Primate Center, and we'll be discussing today the pathology of non-human primates. If we could go to the first slide. I'd like to acknowledge the contributions of Meredith Simon at the New England Regional Primate Center, Ross Terrara at the California Regional Primate Center, Jean Hubbard at the Southwest Foundation for Biomedical Research, Amy Osborne at the Washington Regional Primate Center, and Michael Axthelm at my own institution for their contributions of slides and material for this talk. To give you a brief overview of primate taxonomy, since the differences of disease entities that show up in New World and Old World monkeys can be significant, a brief overview is that prosimians include the bush babies, pottos, and lorises found on the African continent. Lemurs, the other major group of prosimians, are found in Madagascar. Of the higher primates, the division into New World and Old World, New World monkeys are found in Central America and South America, and the two major groups are calatrichids, which are the marmosets and tamarins, and the cebids, which are owl monkeys, squirrel monkeys, spider monkeys, and a group of large, diverse group of monkeys that we don't see as often, including the wakaris, howler monkeys, and other related species. In the Old World monkeys, there's a very large, diverse group of monkeys, the cercopithecids, which includes the macaques, the guenons, the baboons, the leaf-eating monkeys, langurs, colobus monkeys, and the apes. The lesser apes are the gibbons, and the great apes, of course, are the orangutans, the two species of chimpanzees, gorillas, and man. Briefly looking at a few of these, this is a ring-tailed lemur from Madagascar, a galago, potto. These are all prosimians with the elongated noses. This is an owl monkey, or Aotis, from South America. We're now into the cebid group. Squirrel monkey, another cebid, New World monkey. And in the Old World monkeys, Rhesus macaques, Japanese macaques, Macaca fuscata, celebes or Sulawesi crested macaque, and olive baboon, Papio anubis. And starting with the first of our systemic groups, this is Integumentary System. This is normal. This is the sex gland in the chest of an Aotis monkey. I include this because it is just a good example of normal anatomy that maybe that's different between the Old World and the New World monkeys. Other groups of New World monkeys also have similar sex glands at the base of the tail. This is pediculosis, lice infestation in the skin of a baboon. This is occasionally reported in a variety of species of non-human primates. Both sucking and biting louse have been reported. Generally causes a superficial infection with limited tissue reaction. This particular case was caused by pediculosis obtusus, and here's the louse involved. This is a baboon with pyogranulomatous or granulomatous dermatitis. This is caused by Histoplasma capsulatum, variation du Boisii. This is the African histoplasmosis. Predilection sites are the face and other portions of the skin. This is, again, pyogranulomatous dermatitis with ulceration due to Histoplasma capsulatum, du Boisii. African histoplasma is distinguished from capsulatum by having very large yeast forms in the subcutaneous pyogranulomatous reaction, generally 8 to 15 microns. This is pyogranulomatous dermatitis in the skin of a macaque. It represents Coccidioides immitis infection. Coccidioides is typically found in the arid portions of the southwest of the U.S. This is the hands of a chimpanzee. The lesions are granulomatous dermatitis. with depigmentation and some degree of ulceration. This is leprosy. This is a natural infection in chimpanzees, and sooty mangabes. Typically, it causes a histiocytic or lepromatous response in macaques with lack of cell-mediated immunity evident. Lesions are found primarily on the cooler portions of the skin, extremities, scrotum, etc. Pathognomonic for leprosy is involvement of nerves, and the etiologic agent is Mycobacterium leprae. This is a case of, this again is granulomatous dermatitis due to leprosy. It's experimental transmission in a Formosan rock macaque. And just to remind you, the presence of acid-fast bacteria in the histiocytic cells within the inflammatory response. This is a owl monkey with dermatophilosis. Dermatophilosis is caused by Dermatophilus congolensis. This represents a superficial epidermitis with orthokeratosis, parakeratosis, and superficial infiltrates of neutrophils within the epidermis, and shows the typical response in non-human primates as in other species to dermatophilosis. This is a Rhesus macaque with measles. There's conjunctivitis and an exanthematous rash. This is the thoracic region of a macaque with measles. You can see more of the exanthematous rash. There's a secondary bacterial pustule here. And this is the tongue with lesions analogous to Koplik spots in humans. In humans, the Koplik spots, which represent areas of vasculitis and superficial mucosal necrosis, are generally show up in the buccal cavity prior to the appearance of the exanthematous rash. Measles is a disease of humans that is for which humans are the reservoir. It is an abnormal disease of non-human primates. And both New World species and Old World species are susceptible. In Old World species, there typically is an interstitial pneumonia. In New World monkeys, there's more commonly a fatal gastroenteritis. Both conditions are characterized by necrosis of mucous membranes and syncytial cell development. This is a monkey from Africa with monkeypox. There are 4 groups of pox viruses affecting non-human primates. Monkeypox is an orthopox caused by an orthopox virus, which is antigenically related to both vaccinia and smallpox. It is a zoonotic disease, affects man and non-human primates, typically found in the rainforest of West and Central Africa. These are the typical umbilicated, raised umbilicated lesions of pox virus. This is Ortechapox. It's in the benign epidermal monkeypox virus group. These pox viruses are, there's a group of pox viruses, it also includes Tanapox, that are antigenically related to each other but not to vaccinia or smallpox. These photos represent an outbreak in the mid-60s in several different primate centers, including Oregon, thus the acronym ORTECA. The other outbreaks were in California and Texas. These are, again, the umbilicated lesions of pox virus representing epidermal hyperplasia and necrosis. This again is another young Rhesus macaque with the raised and now ulcerated pox lesions. And this is a good example of iatrogenic transmission of the pox virus through the tattoo needle. This is again Orteca pox. These are, this is a zoonotic disease, and lesions were generally self-limiting and regressed within 8 to 12 weeks after infection. And this is just the EM of the pox viral particle involved. The two other pox viruses reported in non-human primates are Molluscum Cattagiosum, which occurs in chimpanzees and man, and though it may occur anywhere on the skin, is generally found has a predilection for the eyelids and groin. And the other is yabapox, which instead of infecting epidermal cells, infects histiocytes, and again causes these raised soft sub-Q nodules that histologically resemble benign histiocytomas. Yabapox also is a self-limiting disease. This is the groin region of a chimpanzee with Chimpanzee Varicella. This is the herpes virus related to varicella in humans, which is the causative agent of chickenpox. What we see is a herpetic rash. This is vesicular dermatitis. In chimpanzees, this tends to be primarily a superficial, a cutaneous infection. The other species of varicella-related diseases include Liverpool vervet virus, medical lake macaque virus, and delta herpes virus, all of which occur in mostly in old world monkeys and is associated with disseminated herpes viral infection and necrosis in multiple organs, and is often fatal. This is the chest of a baboon with multiple papillomas or papillomatosis. This is causative agent for this is papillomavirus, of which a variety of host species-specific papillomaviruses have been described. This is papillomatosis in a juvenile Rhesus macaque. Evident here is probably both the papilloma and I think with the discoloration evident in the tissue that this is undergoing regression and rejection, so that there's evidence of secondary necrosis also. This is the axillary region from a Rhesus macaque with the maculopapular rash of SIV, simian immunodeficiency virus. This appears to be a primary retroviral lesion. Typically, the maculopapular rash shows up within several weeks of inoculation or infection with SIV. And in most animals regresses after a few weeks. This is the skin from a cynomolgus macaque showing multiple cutaneous hemorrhages. This is a nonspecific lesion. Any of the causative agents of cutaneous hemorrhage could be implicated, specifically DIC, septicemia, etc. This is the digit from a macaque with the lesion of calcinosis circumscripta. This is a uncommon finding in macaques. Histologically, it resembles it's the same as calcinosis circumscripta in other species. Deposits, multilobular deposits of calcium salts with a granulomatous inflammation surrounding them with multinucleated giant cells. Of the few cases I've seen, they've all involved digits extremities. Going to respiratory system, this is the anterior thoracic region of subcutaneous region of a baboon. Baboons have a large air sac in this region, and this fluid, this is obviously an abnormal air sac. This is fluid filled with suppurative exudate, so suppurative air saculitis, not an uncommon finding in baboons. This is an air sac dissected out, again with a necrotizing suppurative air saculitis. Any of a group of bacterial agents could cause this lesion. This is lung mites in a macaque. The incidence of lung mites is quite high in imported macaques and in macaques untreated. In our institution, we had routinely not treated our indoor animals with ivermectin for a number of years, and because lung mites are transmitted directly, we actually had a propagating infestation of lung mites throughout the colony, particularly in older animals. The most common causative agent is Pneumonissus summa coli. Other species of Pneumonissus may be causative. There are several manifestations of lung mite infection. This is a fairly classic appearance. It causes an eosinophilic granulomatous pneumonia with bronchiectasis, and histologically you also see marked smooth muscle hyperplasia and accumulation of mite pigment, which can be refractile, and you both see granular refractile eosinophilic material and also pigmented material. This pigmented material can also be deposited in the tracheobronchial lymph nodes. So typically you'll see increased discoloration of the tracheobronchial lymph nodes in chronic lung mite infection. I think in this slide you can sort of appreciate that slightly greenish cast that goes along with eosinophilic granulomatous pneumonia, as well as the bulla formation and or bronchiectasis. And we'll go through a series of these. This is the other common appearance in our institution with these sort of flat, depressed, plaque-like areas and small subpleural pulmonary bulli. Again, this is lung mite infection in a macaque. Treated lung mite infections often are resolved to very small pulmonary bulli, subpleural bulli, with just a fine rim of histiocytes containing mite pigment at the periphery of the lesion. This is from a gelada baboon. And this is, again, this sort of mixed chronic infection with bulla formation and the plaque-like lesions of granulomatous pneumonia. And again, I think perhaps here you can appreciate some evidence of the bronchiectasis reflected on the subpleural surface. And a cut section, this is fixed lung on cut section, where you can see the bronchiectasis. You might also be able to appreciate that this would represent granulomatous pneumonia and smooth muscle hyperplasia. And histologically, the mites are readily visible within the lesions, as well as the granulomatous inflammation. And I think you can appreciate that there's pigmented material here and here. These are also visible on a dissecting scope as small, non-pigmented white mites at the distal ends of the bronchioles. They may lead to the development of large pulmonary bulli or bullous emphysema, as in here. You can also perhaps appreciate that there are very small subpleural bulli associated with this. And again, pulmonary bullae associated with lung-wide infection in a macaque. This is a case of pyogranulomatous esophagitis and pneumonia caused by Coccidioides immitis in a baboon. The Coccidioides is primarily a respiratory infection. Here there was communication between the esophagus and the underlying lung, resulting in esophageal perforation. And here's the endospore of Coccidioides immitis. These are quite large and have a thick-walled endospore. This is the lungs from a macaque with pneumocystis carinii pneumonia. This is pneumocystis pneumonia is almost essentially always associated with immunodeficiency and most commonly with SIV infection. The histologic lesion is alveolar histiocytosis and proteinosis with the fungal organisms easily demonstrated by silver stains. Grossly, this is the more common presentation, which is this diffusely enlarged lung, which doesn't collapse upon opening the thoracic cavity. These are the lungs, heart, and trachea from a cynomolgus macaque. This is caseating granulomatous pneumonia. Causative agent is Mycobacterium tuberculosis. Obviously, the disease is tuberculosis. There's perhaps an increased incidence of disease in cynomolgus macaques. I'm going to show you in various different organ systems the manifestations of TB. It is, though an uncommon disease in the U.S., of course, it is one of the primary diseases of concern in primate colonies. Man is the reservoir host. That's probably on. This is fixed tissue, again from a cynomolgus macaque. This is lung, and again, you can appreciate caseating granulomatous pneumonia due to Mycobacterium tuberculosis. And just a reminder of the multinucleated giant cells associated with this. Mammalian TB may often be associated with very small numbers of organisms, so that it's important to look closely at slides with the acid fast to ensure the diagnosis. This is lobar, probably lobar rather than, but it's suppurative bronchopneumonia in a baboon. The etiologic agent is any of a number of bacterial causative agents, strep, staph occasionally, Klebsiella, Pasteurella rarely, may be associated with suppurative bronchopneumonia. And again, this is a somewhat more classic presentation of suppurative bronchopneumonia. With anterior lobe involvement. This is fixed tissue and cut section with suppurative bronchopneumonia and abscess formation. There's cavitation here. This is due to Staph aureus. Two predisposing factors for Staph aureus infection in macaques are immunosuppression with retrovirus type, simian retrovirus type D, and the other is chronic catheterization for research purposes. This is suppurative bronchopneumonia and pleuritis in a baboon. This is acute lobar pneumonia caused by Klebsiella pneumoniae in a Rhesus macaque. This is acute fibrinosuppurative pleuritis, again caused by Klebsiella. The other etiologic agent likely to be seen with this acute fibrinosuppurative pleuritis would also be Streptococcus pneumoniae. This is an owl monkey, again with lobar pneumonia due to Klebsiella pneumoniae. This is a Rhesus Macaque, lungs with fibrinous or fibrinosuppurative pleuritis. In this case, the etiologic agent was E. coli. This is aspiration pneumonia in a Rhesus macaque. This I included not because it's a great slide, but it sort of brings up your ability to locate anatomically. This represents liver, the ends of the ribs. This membrane is the thickened pleura of chronic fibrosing pleuritis with pyothorax. You can appreciate the standing fluid within the thoracic cavity, and perhaps also the small amount of very congested and edematous lung. This was due to Pasteurella multocida, not a common finding in macaques, but an occasional etiologic agent of bacterial pneumonias. And this represents severe edema and congestion within the lung of a macaque. Because macaques have closed alveoli, this mosaic pattern is very common in both pulmonary edema and pneumonias. This is an embolic pneumonia. The etiologic, any of a variety of etiologic agents could be responsible. This could be this could represent measles in an old world monkey. The giant cell pneumonia of SIV rarely appears like this, but could, and Klebsiella, diffuse Klebsiella infection in New World monkeys might also have this somewhat hemorrhagic appearance. This is embolic pneumonia in a marmoset. The etiologic agent is herpes simplex, septicemia. This is again one of the herpes viruses in an abnormal host. Causes embolic pneumonia and also multifocal necrosis in a variety of visceral organs, liver, spleen, etc. This is lipid pneumonia. It's a cross-section of lung from a Rhesus macaque. It has a fairly distinct gross appearance of these almost oily, confluent areas of granulomatous inflammation. This is lipid pneumonia, again, in a Rhesus macaque. It has this very pale, slightly somewhat tan appearance, consolidated lung. It has a very distinctive histologic picture of large areas of lipid accumulation surrounded by granulomatous inflammation and fibrosis. These infections tend to be, in my experience, have been clinically, I've seen them, they're clinically silent at the point that I've seen them. They represent mineral oil administration many years prior with mineral oil medication with aspiration. The mineral oil essentially never clears from the lungs, and you have this chronic granulomatous response. This is meconium aspiration. These are the lungs of a neonatal Rhesus macaque. Typically, to be able to appreciate the meconium aspiration, or the thing that makes it distinct, is the appearance of this a slightly yellowish to greenish cast to these lungs. It is associated with fetal distress in the neonatal macaque, or neonatal species. If it has any chronicity, if it's occurred in utero and the animal's able to survive to a certain point, there is a remarkable pyogranulomatous response. This is umbilicated metastatic carcinomas. This is squamous cell carcinoma. The primary site was in the cervix. Neoplasia is extremely rare in most non-human primate species, particularly in the Rhesus macaque, and metastasis is an even rarer event. However, I have seen a few cases of squamous cell carcinoma of the cervix, and both of them have metastasized to the lungs. This is lymphosarcoma in a baboon. Lymphosarcomas are often associated with viral etiologies. In the baboon, it's associated with STLV1 infection. This is lymphosarcoma in the lungs of a common marmoset. The common etiologic agent for lymphosarcoma in marmosets, as well as tamarins, owl monkeys, spider monkeys, and howl monkeys, is herpes simeri infection. Herpes simeri's natural host is the squirrel monkey. This is again sort of a gee whiz lesion. It's the trachea from a aged Rhesus macaque. What you can appreciate are these dark red areas, and these represent mineralization and subsequent ossification of the tracheal cartilage, and then subsequent extramedullary hematopoiesis within those areas of ossification. Cardiovascular system. This is the mediastinum and lung from a cynomolgus macaque showing serous atrophy of fat. You can appreciate the clear translucent deposits. This is the heart from a Rhesus macaque with fibrinous pericarditis. Again, a variety of bacterial species, most commonly strep, E. coli, and staph can cause fibrinous pericarditis and epicarditis. This is fibrinous epicarditis secondary to E. coli septicemia in a rhesus. This is suppurative pericarditis, epicarditis in a Rhesus macaque. On cut section, you can appreciate that there's both a suppurative pericarditis as well as myocardial abscesses. Again, one of the two predisposing factors in this could be either chronic vascular catheterization and or type D retrovirus infection. The next series of slides are various manifestations of valvular endocarditis. Here we can appreciate it on the mitral valve. Again, mitral valve, valvular endocarditis, bacterial in origin. Valvular endocarditis. Valvular endocarditis. Again, most frequent site is mitral valve. This is a baboon, not a particularly pleasant photo. What it is meant to represent is the sudden death with massive pulmonary edema and subsequent postmortem leakage due to congestive heart failure. And in this case, congestive heart failure was due to encephalomyocarditis infection. The gross lesions are well represented here. What we see is the pale heart representing myocardial necrosis plus or minus myocarditis with a mononuclear infiltrate. The pericardial fluid or effusion. I think you may be able to appreciate that there's some degree of chronic passive congestion and increased reticular pattern in the liver, and that there is massive pulmonary edema and congestion. Cephalomyocarditis virus is reported to cause disease in a variety of non-human primate species, may appear as an epizootic. It also causes clinical disease in elephants and pigs. Mouse is the reservoir, or rodents are the reservoirs for this infection. It's a cardiovirus in the Procorniviridae family. And there I have a few pictures of the histology. Myocarditis with a mononuclear infiltrate. And you all may also see peracute myocardial necrosis. This is a thrombus in the left ventricular cavity at the apex. The etiology for this was unknown. You obviously expect some degree of precipitating lesion would be endocardial damage. This is a owl monkey with uremic myocarditis. The lesion represents a coronary arteriolar vasculitis or degeneration with subsequent myocardial necrosis. And I'm going to show you a series of slides with left ventricular hypertrophy. This is left ventricular hypertrophy in a Rhesus macaque that was a DOA from in a group of Chinese Rhesus recently imported. This is left ventricular hypertrophy in a Rhesus macaque. This is dilatative cardiomyopathy associated with endocardiosis in the mitral valves of an aged Rhesus macaque. This is cardiomegaly in a squirrel monkey. And this is left ventricular hypertrophy, perhaps associated with an aortic valve lesion. This is the liver from that monkey, showing the classic reticular pattern of chronic passive congestion. This is the thoracic cavity, showing marked cardiomegaly in an owl monkey. And again, cardiomegaly in an owl monkey. Left ventricular hypertrophy, owl monkey. Dilatative cardiomyopathy in an owl monkey, and severe left ventricular hypertrophy. You can also appreciate areas of prior necrosis and fibrosis within the cross-section of the left ventricle. And this is the liver from an owl monkey, showing severe chronic passive congestion, the classic nutmeg liver pattern. Having shown you a series of owl monkeys, there is some evidence for systemic hypertension with hypertrophy of small muscular arterioles, in this case in the intestine. And there is a high incidence of cardiac lesions in owl monkeys in captivity. This is cardiomegaly with right-sided enlargement in a neonatal Rhesus macaque, and this was an atrial septal defect. Congenital heart defects are relatively rare in Rhesus macaques. This is probably one out of a large number of infants we've seen. Congenital defects in general are somewhat rare in macaques. This is lymphosarcoma in a Rhesus macaque. It would be likely to be associated with SIV infection. This is an owl monkey with an aortic aneurysm. You can appreciate the marked dilatation at the base of the aorta. This is the abdominal cavity with the abdominal aorta and iliac bifurcation with aneurysms in a Rhesus macaque. This is abdominal aorta and iliac bifurcation with atheromatous and perhaps fibrous plaques in a Rhesus macaque. Spontaneous atherosclerosis is reported in a variety of non-human primates. This would represent the fatty streaks of atherosclerosis, which is not an uncommon finding in aged macaques. The incidence of atherosclerosis is, of course, markedly increased with atherogenic diets. This is the aorta of a baboon exhibiting aortic mineralization. I think you can appreciate that this is this is an opaque white appearance versus the somewhat yellow appearance of atherosclerosis, as you would find in any species. Going to hematopoietic system, this is the pluck, mediastinum, heart and lungs from a juvenile Rhesus macaque, 1.5 years of age. This represents the normal amount of thymic mass. Thymic involution is extremely common in stressed individuals, particularly in neonates, but this would represent somewhat the normal expected volume in an animal of this age. This is the trachea and main bronchi of a cynomolgus macaque. This represents the enlarged lymph nodes with granulomatous lymphadenitis of tuberculosis. Again, obviously the causative agent is Mycobacterium tuberculosis. And this is cut fixed tissue in cross-section of a cynomolgus macaque with TB. Perhaps it's appropriate to note at this point that this is lung and this is spleen. Again, these are the caseating granulomatous areas of inflammation. Tuberculosis is not exclusively a pulmonary disease in non-human primates and is very likely shows up as a systemic disease, so that lesions are rarely confined just to the lung, but also affect other lymphoid organs and, in fact, any part of the viscera and bones. This is a cross-section of spleen with caseating granulomatous inflammation due to tuberculosis. This is a spleen from a young juvenile, young Rhesus macaque with tularemia. Tularemia is endemic in our institution. We see a small number of cases, generally in 1 to 2 year old monkeys every year. Lesions are most frequently in the, they're highly lymphotropic. We see lesions predominantly in superior mesenteric lymph nodes, peripancreatic lymph nodes, and the spleen, as well as we may see a necrotizing pneumonia and necrotizing hepatitis. But these represent areas of lymphoid necrosis and or necrotizing inflammation. It is very lymphotropic, and these areas are almost always centered around lymphoid follicles and expand from there. This is another case of the small areas of necrotizing splenitis of tularemia, causative agent Francisella tularensis. It is generally carried by rodents in the, and these cases are found in animals in outdoor housing. This is, again, multifocal necrotizing splenitis, obviously a more florid case due to Francisella tularensis in a juvenile macaque. This is the pancreas and peripancreatic lymph nodes, again showing the massive enlargement and necrotizing inflammation associated with tularemia. And this is the abdominal cavity, descending colon lumbar lymph nodes, and you can appreciate through the capsule the appearance of these areas of necrosis within the lymph node. This again is tularemia. These are the spleens from two different squirrel monkeys. The more normal one is on the bottom. The upper one is the animal affected with yersiniosis. Both Yersinia pseudotuberculosis and Yersinia enterocolitica are both reported in non-human primates. This needs to be differentiated from tularemia in our institution, though it rarely has this appearance. This is the massively enlarged lymph node. It's full of gram-negative colonies of gram-negative bacteria. This is an owl monkey with vitamin E responsive anemia. What you can appreciate is pallor of the viscera and subcutaneous tissues, and the enlarged liver with a slightly brownish cast. You can also see the tip of the spleen, which will also be enlarged. This is a hemolytic anemia, and the signs are gross signs are reflective of a severe anemia and hemosiderosis, which reflects the pallor of the tissues and the enlargement of the liver with a slightly brownish cast, as well as the spleen. In addition, there will be massive extramedullary, marked extramedullary hematopoiesis in a variety of visceral organs, most prominently in the liver and spleen. And this is the liver and spleen from another owl monkey with vitamin E responsive anemia. This is the cross-section of spleen from a Rhesus Macaque showing marked lymphoid follicular hyperplasia. This is almost always associated with SIV infection, though it's not pathognomonic in any way. Typically, early in SIV infection, you may see marked lymphoid hyperplasia. And again, this is marked lymphoid hyperplasia in the spleen of a Rhesus macaque infected with SIV. This is an incidental lesion in an aged cynomolgus macaque, just showing capsular fibrosis of the spleen. Nonspecific change, typically associated with prior lesions on either the spleen or the sequela to peritonitis. This is a spleen and cut section with amyloidosis. Spleen is one of the organs of often affected in systemic amyloidosis, though it's not the most commonly affected organ, and we may I'll talk more about that later. You can appreciate the somewhat feathery appearance of the deposition. You don't see the large lymphoid follicles. In fact, the lymphoid follicles may often be the central area of deposition, and then the amyloid extends beyond that along the septi and also along the subcapsular region of the fibromuscular stroma. Perhaps the most characteristic appearance is this sort of flat, dull, dark red appearance that's associated with amyloid deposition. Going to liver and pancreas. This is the liver from a ring-tailed lemur with an echinococcal cyst. The larval stage of Echinococcus multilocularis. The definitive host is carnivores with adult cestode tapeworms in the GI tract of the carnivore. This is a baboon with mesocystoides infection in the liver. Mesocystoides may show up as with larval forms either in the liver or in the peritoneum. This is a Rhesus macaque liver with eosinophilic granulomatous hepatitis due to hepatocystis. Hepatocystis is a protozoal organism closely related to Plasmodium. The life cycle is that it's transmitted by a culicoides vector. Sporozoites are introduced into the macaque and develop as merozoites within hepatocytes, forming large merocysts. Merozoites are ruptured into the red blood, into the systemic circulation. They have a erythrocytic phase, which resembles Plasmodium and needs to be distinguished from it. It causes these typical lesions within the parenchyma of the liver. Active infection, again, eosinophilic granulomatous hepatitis with merocyst formation. The active cysts, merocysts, have somewhat less inflammatory response. They may have a small rim of granulomatous inflammation with eosinophilic infiltration also. The ruptured cysts incite much more inflammatory response. This is another case, somewhat milder. You can appreciate on cut section that these merocysts are hollow and filled with colloid material. As this is a baboon with Hepatocystis cocci. As the infection decreases, typically what the resolution is small areas of granulomatous inflammation with mineralization, and in the absence of the protozoal organisms, the diagnosis is somewhat more difficult, but it has a very classic appearance of granulomatous inflammation confined to the liver in imported animals. This is multifocal granulomatous hepatitis in the liver of a cynomolgus macaque. This again is Mycobacterium tuberculosis in a cynomolgus macaque. And this is the lesion in cut section, multifocal granulomatous hepatitis due to Mycobacterium. This is systemic tularemia, again showing multifocal necrotizing hepatitis in the liver of a Rhesus macaque. These are the small areas of necrotizing hepatitis distributed throughout. Your systemic ursiniosis could also, in a macaque, also has almost exactly the same gross appearance, but can be readily distinguished on histology. Tularemia organisms are not evident on H&E section, whereas ursiniosis will show large numbers of gram-negative organisms. Why don't we stop there? This is the liver and spleen from a common marmoset with herpes simplex, and shows multiple areas of necrosis within the liver and spleen. This is the classic presentation for the human herpes simplex virus infection in marmosets and tamarins. This is the liver of a macaque that's showing multifocal necrotizing hepatitis or multifocal hepatic necrosis. The etiologic agent here is B virus or Cercopithecine herpes virus 1. This is an uncommon manifestation of CHV1 or B virus in macaques. Typically, the appearance of B virus infection is oral lesions, oral herpetic vesicles and ulcers in the oral cavity, mucocutaneous junctions, and tongue. Systemic disease is uncommon. It has been reported. There's a vet path article in the mid-90s of the occurrence in cynomolgus macaques. It's associated with multifocal necrosis in the liver and spleen, multiple visceral organs, as well as complete necrosis of the mucous membranes in the oral cavity, esophagus, and stomach. This is again multifocal hepatic necrosis due to B virus infection in a Rhesus macaque due to Cercospithecine herpes virus 1. And this is the histology of that infection. It lacked, in this particular case, the classic herpes viral inclusions. Instead, we see these markedly enlarged nuclei with cleared chromatin. EM was confirmative for herpes viral infection. This is an owl monkey with hepatic lymphoma due to herpes virus Simeri infection. This is as I said, this is a natural herpes virus Simeri is naturally found in the squirrel monkey, causes lymphoma in other New World non-human primates. This is a T-cell transformation with T-cell lymphoma. Liver, spleen, lymph nodes, kidneys, adrenals are most commonly affected, generally with a diffuse infiltrate. It may also appear as a nodular lymphosarcoma. This is a cynomolgus macaque with central lobular hepatic necrosis, acute hypoxic necrosis. Any of the etiologic causes of acute hypoxic necrosis are applicable. This is a Rhesus macaque with focal hepatic lipidosis, tension lipidosis due to the capsular fibrosis here. This is callitrichid hepatitis in a marmoset. Gross appearance is this enlarged yellow-tan, occasionally mottled liver. There may also be icterus, subcutaneous hemorrhages, increased size of the spleen, and pleural and peritoneal effusions. It's caused by an arenavirus. It's carried by mice, related to the lymphocytic choriomeningitis virus, and may cause epizootics of hepatitis in callitrichids. This is hepatic lipidosis in a Rhesus macaque. This is commonly associated with fat or obese macaques, both Rhesus and cynomolgus macaques, and can cause a fatal fasting syndrome in these animals. There is massive hepatic lipidosis, deposition of lipid within hepatocytes, typical histologic and gross appearance of hepatic lipidosis. And again, this is hepatic lipidosis due to fatal fasting syndrome. It is often in macaques also associated with deposition in the renal tubules, as well as fat necrosis in the subcutaneous fat. And animals dying of hepatic lipidosis are often still have large volumes of fat in the subcutaneous and visceral regions. This is the liver from an aged Rhesus macaque showing several lesions. There's subcapsular telangiectasia, amyloidosis, most apparent at the margins, and this reduplicated gallbladder. Telangiectasia is a common incidental lesion in aged macaques, not normally quite so large. Areas are involved. It represents hepatic cell loss and dilation of the sinusoids in the subcapsular regions. Hepatic amyloidosis is a common lesion in macaques. Generally, this is secondary generalized amyloid, amyloid AA, from acute phase reactants, serum amyloid A precursors. It is most often associated with either chronic degenerative osteoarthritis and or inflammatory bowel disease syndromes. The causes marked enlargement of the liver with this somewhat flat, dull appearance, very waxy appearance. Again, this is hepatic amyloidosis in a macaque. This is a more severe case of hepatic amyloidosis. As the hepatic atrophy continues, the appearance becomes more of this white, pure amyloid deposition, and these livers may be severely enlarged, extending almost to the pelvic canal. Again, this is hepatic amyloid. And this is a somewhat less severe case, but it shows that very flat, waxy appearance evident in these livers. The classic article is by Blanchard and Baskin describing amyloidosis in macaques from the Tulane Primate Center. And in their study, amyloid was most frequently deposited in the small intestine, and hepatic amyloid occurred in about 40% of the cases. In our institution, I would say that we are more likely to see hepatic involvement, and we often see hepatic involvement with involvement in other organs with deposition in the small intestine, not quite as common. It causes a protein-losing enteropathy when it does occur in the small intestine. This is an uncommon lesion. It's large granular cell lymphoma, leukemia, in a stump-tailed macaque in the spleen and liver. And this is the liver in cut section. This is focal lymphosarcoma in the liver of a baboon. And this is hepatocellular carcinoma in a Rhesus macaque. Again, this is an uncommon, neoplasia is an uncommon finding in Rhesus macaques. This is chronic separative cholangitis in a macaque. The two common entities of chronic cholangitis in Rhesus are the chronic proliferative cholangitis associated with cryptosporidial infection and also enterocytozoan infection associated with immunosuppression of SIV, and the other is ascending bacterial infections from the GI tract in non-immunosuppressed animals, most commonly associated with Campylobacter infection, though other bacterial agents may also cause this lesion. And again, chronic cholangitis with fibrosis in these liver sections and cut section. This is chronic cholecystitis with calculus formation in a baboon. Multiple gallstones in the gallbladder of a ring-tailed lemur, and multiple gallstones in the gallbladder of a baboon. These are often primarily cholesterol in composition. This is the pancreas of a Celebes ape with polycystic pancreas This represents an obstructive lesion with ductictasia. In this particular case, this may be iatrogenic, secondary to repeated pancreatic biopsy. This is the peripancreatic region in a tamarin with saponification of fat, secondary to chronic pancreatitis. Gastrointestinal tract, starting with the oral cavity. This is ulcerative, necroulcerative gingivitis in a Rhesus macaque. This is the classic gingivitis associated with Shigella flexneri infection in macaques. And again, this is another example of the ulcerative gingivitis associated with Shigella flexneri, as well as severe dental calculus formation. The necroulcerative gingivitis of Shigella should be distinguished and is easily distinguished from noma, which is a severe necrotizing gingivitis and osteomyelitis. And these are the lesions of the severe, rapidly progressing necrotizing osteomyelitis. This is a lesion almost exclusively associated with simian retrovirus type D infection. A variety of bacterial species can be cultured from this. At the leading edge of the lesion is almost always a spirochete bacteria. And the lesion always starts at the gingiva and alveolar involucrum and progresses to the severe osteomyelitis. Again, the mandibular osteomyelitis of noma. The oral cavity and tongue of a Rhesus macaque with necroulcerative glossitis, secondary to B virus infection, or cercopithecine herpes virus 1. This is the classic presentation resembling herpes simplex virus in man. Again, a somewhat more chronic case of the necrotizing and ulcerative glossitis due to CHV1. And again, this is the conjunctivitis and palpebral edema and herpetic lesions at the mucocutaneous junction in a juvenile macaque with B virus. This is the oral mucous membranes of a chimpanzee with papillomatosis, multiple papillomas. Again, this has got a viral etiology, papillomaviral infection. This is an uncommon finding. This is a fibromatous epulus in the hard palate of a Rhesus macaque. This is the esophagus of a juvenile Rhesus macaque with Candida albicans, candidiasis. This is a lesion almost essentially always associated with immunosuppression. This particular animal was not infected with SIV. It was under under an experimental protocol that probably induced immunosuppression. The lesion is, of course, some degree of hyperkeratosis and exudative inflammation, superficial neutrophilic infiltrates with large numbers of yeast and pseudohyphae. The linear, this is again esophageal candidiasis. The linear appearance is somewhat more typical than the previous slide in esophageal candidiasis. And this, of course, represents the yeast and pseudohyphae in the superficial portions of the mucosa with Candida albicans. This is the esophagus from a baboon with multiple linear ulcerations. I'm not aware of the etiology in this particular case. This is the esophagus and trachea from a baboon with esophageal necrosis secondary to this trichobezoar lodged within the esophagus. This is a classic historical non-human primate disease, paraesophageal granuloma or kaolin granuloma. This is from unsuccessful stomach tubing of animals with diarrhea given kaolin with puncture of the esophagus and the development of this paraesophageal granuloma. This is the stomach of a macaque, Rhesus macaque, with nodular gastric hyperplasia. Due to noctia nocti, you can actually see the stoma in which the nematode would be found. Noctia nocti is a trichostrongyle, very small, filiform, red nematode. Induces this either nodular gastric hyperplasia, and the entire nematode is normally located within the nodule. This is, again, the stomach of a macaque with a adenomatous polyp or papilloma, again due to noctia nocti. The other nematode commonly found in the stomach of macaques is Physoloptera. Again, it causes a nodular hyperplasia, gastric hyperplasia, and you can also appreciate some of the nematodes loose in the lumen. Physoloptera is several times larger than noctia nocti, not red, and in Physoloptera infection, there's normally just the anterior end of the nematode is involved, and the remainder of the nematode is seen free in the gastric lumen. This is the stomach of a baboon with Physoloptera. This is a less common presentation with this more acute gastric inflammation evident here. This is a gastric ulcer in the stomach of a macaque. This is secondary to Helicobacter pylori infection. This is a Rhesus macaque stomach with a large gastric ulcer. Differential for this in leaf-eating monkeys, the colobine monkeys, would be amoebic abscesses, which cause a similar lesion. This is a gastric trichobezoar in a Pato prosimian, and a gastric trichobezoar in the stomach, the gastric trichobezoar in a baboon. Certain species of non-human primates are particularly prone to these. In our institution, the Japanese macaques, which have an abundant hair coat, are very prone to gastric trichobezoars. They can be, in general, clinically silent and are often associated with marked muscular hypertrophy at the pyloric outflow tract. This is the stomach of a baboon with gastric infarcts. Primary differential would be renal failure in this case, uremic gastritis. This is a baboon with nodular gastric hyperplasia, mucosal hyperplasia. This has been proposed as a model of Menetrier's disease or gastric hyperplasia in humans. In the baboon, it's associated both with an inflammatory response, giant foveolar hyperplasia with lymphocytosis, and without lymphocytosis. This would represent the histology for the growth slide I just showed you. Gastric dilatation or bloat is a fairly common disease entity or syndrome in captive macaques, typically housed indoors, caged macaques. We almost never see it in our outdoor animals, and is probably the most common cause of sudden death in caged macaques. It is a pure bloat, not associated with volvulus. again, this is another manifestation of it. Typically, what we see is this a necrosis of the small bowel, displacement of the small bowel. This is an ischemic necrosis. This is a less common manifestation. Normally, we would see more congestion in the distal organs. And again, we see this gastric rhexis, and typically this may be associated with rupture post-mortem. This is lymphosarcoma in Rhesus macaque. Again, this is most commonly associated with SIV infection. This is the ileocecal region of a squirrel monkey with prosthenorchiasis. This is a parasitism typically seen in New World monkeys, caused by Prosthenorchis elegans, which is an acanthocephalid or thorny-headed worm. It requires an intermediate host of a cockroach. You may see nodules on the serosal surface, and rarely may cause either rupture of the gut and or mechanical obstruction in large numbers. This is again a squirrel monkey with the ileocecal junction with prosthenorchiasis, and you can appreciate the nematodes through the serosal surface here in the gut of a New World monkey. This is esophagostomiasis in a pigtailed macaque, showing the typical lesions on the serosal surface. The macaques, the colon always have these three tania, so that identification of the colon is always easy. And these subcutaneous nodules contain necrotic debris, red cells, and the fourth stage larvae of the esophagostomum nematode. The adult is then found free within the lumen of the colon. These generally just cause these subserosal nodules as they bury the four-stage larvae burrow into the submucosa and muscularis. Rarely they may cause rupture and peritonitis. This is the esophagostomum adult in the lumen of the large intestine. And these are several different examples of esophagostomiasis in macaques at the ileocecal junction. This is the colon from a macaque with trichiuriasis, and also probably unrelated to the trichiuris infection is a acute colitis with fibrinous exudate and edema and hemorrhage within the colonic mucosa. This is trichiuriasis in the colon of a macaque. Typical whipworm nematode with the sort of fat distal end and the very thin whip-like anterior end, which is normally embedded in the anterior end is embedded in the mucosa of the colon. This is a capuchin monkey. Cebus is the genus. This is Yersiniosis with hemorrhagic typhlocollitis. This is a classic raspberry mucosa. It's a necrotizing and hemorrhagic infection. Typically, we see large numbers of gram-negative bacterial colonies within the mucosa. This is, again, this is a squirrel monkey with Yersiniosis. You can also appreciate in the mesentery the enlargement of the lymph nodes, as well as the hemorrhagic colitis. This is again Yersiniosis in a Rhesus macaque. Yersiniosis may be associated with either Yersinia pseudotuberculosis or Yersinia enterocolitica. In this case, Yersinia pseudotuberculosis was cultured from the gut. And again, this is Yersiniosis in a macaque. I think you can appreciate the degree of edema within the mucosa and also this fibrinous exudate. These are button ulcers, also due to Yersinia infection in a macaque. This is a fairly common presentation in our institution for enteric yersiniosis. Unlike some of the other bacterial enteric diseases, Yersinia can occur both in the small intestine and large intestine, whereas Shigella is almost, we'll get to, but is almost always confined to the large intestine, and Campylobacter is more commonly found in the large intestine than small. This is hemorrhagic enterocolitis due to Salmonella. Salmonellosis is relatively rare compared to the other enteric bacterial diseases. This is the hemorrhagic colitis of Shigella flexneri. And again, this is shigellosis. This is a fairly classic presentation. The necrotizing and ulcerative inflammation with pseudomembrane formation. It has a very common appearance of this sort of tattered, diffuse, dull appearance throughout the colon. It is most often concentrated at the cecal-colic junction, with the cecum and proximal 1/3 of the colon being the most severely affected. This is again, this is a somewhat milder case of Shigella colitis. This is the luminal accumulation. This is somewhat milder case of Shigella colitis with this luminal accumulation of fibrin and mucin admixed, as well as the inflammatory, suppurative infiltrate. This is again the ulcerative hemorrhagic fibrinonecrotic colitis of Shigella infection. This is a hemorrhagic colitis in a baboon. Again, a common etiology would be Shigella, but I'm not aware of what was cultured from this particular case. This is the cecum and colon ileum from a TD monkey, which is a species of New World cebid with a severe necrotizing ulcerative typhlocollitis. This is the less affected portion of the gut. This is Campylobacteriosis, hemorrhagic colitis due to Campylobacter jejuni infection. We see Campylobacter jejuni and Campylobacter coli are frequently cultured from the guts of Rhesus macaques. The common wisdom is that Campylobacter jejuni is far more pathogenic. It, like Shigella, may also induce a carrier state, and additionally, Campylobacter and Shigella may be both cultured from lesions that look like this. This is fibrinonecrotic ulcerative colitis. And again, the differentials would be Shigella or Campylobacteriosis, acute Campylobacteriosis. The other lesion commonly associated with Campylobacteriosis is a chronic proliferative colitis. And The histologic lesions are typically of marked mucosal hyperplasia and crypt abscess formation, as well as a diffuse inflammatory infiltrate consisting predominantly of plasma cells and neutrophils. This is Rhodococcus equi. What we see is granulomatous enteritis with these necrotic, with these hemorrhagic centers. This infection is typically associated with D virus infection. Again, this is Rhodococcus equi. This is lymphoma in a common marmoset. This is the, again, typically associated with herpes virus symerai infection. Again, lymphoma predominantly in the mesenteric lymph nodes of a marmoset with herpes virus symerai. And again, another manifestation of lymphosarcoma in a marmoset. This is amyloidosis in a Rhesus macaque, both in the colon and small intestine. It's not a beautiful gross lesion in the gut, but I think in the very florid cases you can appreciate that there's some loss of the villus architecture due to the massive enlargement of the mucosa due to the deposition of amyloid. And it has this sort of flat, sort of bland appearance throughout the, particularly in the anterior small intestine. This is also represents amyloidosis, and although there's mucin material adherent to the mucosa, I think you can also appreciate the sort of the loss of the finely pebbled appearance of normal villi. This is an intussusception in a Rhesus macaque. Classic presentation. These are reasonably common in animals with enteric disease, particularly in young animals. This is chronic ulcerative colitis with stricture. The primary differential for this lesion is adenocarcinoma, which may have a very similar appearance, but typically what we see are these areas of chronic prior ulceration and subsequent healing with stricture formation. Again, this is a case of chronic ulcerative colitis with stricture formation and some development of megacolon. This is again a rectal stricture, chronic ulcerative colitis with stricture and secondary megacolon formation. This is, in contrast, a rectal stricture secondary to an adenocarcinoma in a squirrel monkey. This is bladder here, and we see the development of megacolon. And this is the gross appearance of the rectal stricture secondary to colonic adenocarcinoma. And this is again a different case of stricture due to adenocarcinoma and secondary megacolon formation. Colonic adenocarcinoma. Of all the neoplasias, this is by far the most common neoplasia seen in macaques. It is a relatively common lesion in aged macaques. It appears to develop fairly slowly. Lymph node metastasis is common. Multiple adenocarcinomas are common. Metastasis to other organs is rare and late in the disease, and when it does metastasize, it typically shows up in the liver. Again, adenocarcinoma in the colon. This is a fairly common presentation. We'll see this mucosal ulceration, some mass formation but very limited, thickening of the wall, marked fibroplasia often. This is a less common presentation. This is cecal adenocarcinoma in a baboon. Lesions this large are very rare. And this is colonic adenocarcinoma, again in a baboon. This is the rhesus again with colonic adenocarcinoma. This is a much more typical appearance, multiple closely associated sites, frequently within the cecum and the very proximal colon. And the primary finding are these areas of ulceration with firm fibrotic desmoplastic response in the wall adjacent, and with or without lymph node metastasis. This is one of the rare cases of adenocarcinoma with metastasis to the liver. The primary site was the colon. This is in a Rhesus macaque. This is diverticulitis in a Japanese macaque. Diverticulosis is not an uncommon finding in older macaques. Diverticulitis is somewhat rarer and generally is confined to one or a small number of the diverticulosis areas. This is rectal prolapse in a young macaque. This is a common finding in stressed animals. Often can be they're self-reducing, but obviously this degree of necrosis requires intervention. This is the specimen dissected. Prolapse occurs as well as intussusception and prolapse depending on the height of the origin of the intussusception or prolapse. And again, this is rectal prolapse in a young macaque. Going to peritoneum. This is mesocystoides infection in the peritoneal cavity. This is the omentum of a baboon. This is tetrathyridian cestode larvae. May cause parasitic ascites if they occur in large numbers. This is abdominal filariasis due to dipedal edema in a New World monkey. In this case, it's a squirrel monkey. These animals are generally have microfilaria in the bloodstream, and in small numbers, they really are not. They're associated with no lesions. They may cause a mild peritonitis in large numbers. This again is an incidental finding of dipedal edema on the small intestine of a squirrel monkey. This is the omentum from a cynomolgus macaque with pentostomiasis. Pentostomids are uncertain classification of arthropod. The larvae nymphs, the nymphs are encysted within the peritoneal cavity of non-human primates. The definitive host is a snake preying on monkeys, and the adults are in the oral cavity of the snake. These are the pentostomids within the cavity, the body cavity of a podo. Armillifer is the genus associated with Old World monkeys and Porocephalus in Old World monkeys. Porocephalus may also be found in New World monkeys. This is the abdominal cavity of a greater galago with numerous hydatid cysts. This is a kinococcal disease. The definitive host is a carnivore. This is caused by Echinococcus multilocularis. And each of these these cysts contain numerous brood capsules and protoscolices, so reinfection within the abdominal cavity with rupture of individual cysts is how you get the development of these large numbers of cysts. These are the protoscolices within the brood capsules within the cysts, and this is the classic hydatid. This is what is the hydatid sand is composed of. This is abdominal fat from a Japanese macaque showing multifocal areas of fat necrosis. Histologically, these are areas of fat degeneration, probably was areas of saponification, and a granulomatous response. This is a lesion associated with fasting and rapid weight loss in macaques, the spectrum of which includes the fatal fasting syndrome in these animals. And this is the omentum from a rhesus with carcinomatosis, again, a somewhat uncommon finding in Rhesus macaques. This is the abdominal cavity of a Celebes or Sulawesi macaque with the lesions of retroperitoneal fibromatosis. I think what you can see is, you can appreciate this marked proliferation of fibrous tissue in the, on the abdominal wall. This is a lesion associated with type D retrovirus and is thought to be caused by radenovirus, the gamma herpes virus, that's the herpes 8, human herpes 8 homolog, the Kaposi sarcoma herpes virus. This is another example of retroperitoneal fibromatosis with the intestines encased in this fibromatous tissue. This is endometriosis in a female Rhesus macaque. And again, endometriosis, you can see these bloody endometrial implants on the serosal surface in the pelvic cavity of, this is the descending colon of a female Rhesus macaque. Urinary tract. This is a Rhesus with chronic active interstitial nephritis. I think you can see the small areas of streaking within the cortex. This is embolic nephritis in a macaque. Again, one of the common predisposing factors in this would be chronic vascular catheterization. But any septicemic disease can result in this. Bacterial septicemic disease can result in this lesion. This is hydroureter and hydronephrosis and renal cortical atrophy, secondary to endometriosis. Commonly, the bladder, the region between the uterus and the bladder, is a common site of implantation for endometriosis, and it frequently results in unilateral or bilateral partial obstruction of the ureters, leading to this lesion. This is suppurative interstitial nephritis due to E. coli. This is a pelvic calculus, hemorrhagic clot, hydronephrosis, and pyelonephritis, all secondary to the calculus. This is interstitial nephritis in a Japanese macaque. And again, this is interstitial nephritis in a Japanese macaque. In my experience, renal lesions are somewhat rare in Rhesus, and when we, I'm much more likely to see it in our Japanese macaques, and typically it's this pattern of interstitial nephritis. This is a Again, a Japanese macaque with hydronephrosis, secondary to calculus formation. This is glomerulonephritis in a macaque, and I think the primary thing to note here is the pallor of the cortex. This is severe renal cortical necrosis in a Rhesus macaque. You can appreciate the pallor with hemorrhage in the cortical tubules. This is nephrosis. Acute tubular necrosis are very common as lesions of dehydration in animals with diarrhea, and enteric disease is a leading cause of death in young macaques in our colony. This degree of renal cortical necrosis is a severe example, and is more likely to be associated with things like pregnancy toxemia. This is nephrosis and myoglobinuria. One of the leading causes of death in animals with intraspecific trauma in group house situations is renal failure, secondary to massive muscle necrosis and myoglobinuria. It would be difficult to make a case for myoglobinuric nephrosis in the absence of marked pigment deposition. There's a small amount of myoglobinuric pigment starting to collect in the pelvis, but this is mostly the nephrosis secondary to hypovolemic shock. This is renal ectopia in an owl monkey. You can appreciate the two ureters coming from the kidneys, which are located on one side of the abdominal cavity. This is a baboon with amyloidosis. Amyloid is occasionally deposited within the kidneys. When it is deposited, it is almost exclusively in the medullary interstitium, and the cortex happens rarely. Less commonly, glomerular amyloid is extremely rare in macaques, and I've never seen it. This came to me as chronic pyelonephritis, and obviously the other differential is a chronic infarct. This is the lipidosis, tubular lipidosis of fatal fasting syndrome of macaques, or fat macaque disease. Lipid deposition within renal tubules is a common finding in macaques. This is the severe tubular lipidosis associated with starvation in fat macaques. And again, this is the hepatic lipidosis and tubular lipidosis in the kidneys. This is the unilocular renal cyst in a aged macaque. And these are polycystic kidneys from a cynomolgus macaque. This is a Celebes macaque with renal cell carcinoma. This is a macaque with renal lymphosarcoma. Again, these are fairly, people take pictures of these because they're uncommon diseases. This is a kidney from a baboon with nephroblastoma. Here's the lesion on cut section. This is the penile urethra of a Japanese macaque with a urethral calculus. This resulted in obstructive uropathy and subsequent rupture of the bladder and peritonitis in this particular animal. It's an uncommon finding. This is chronic hemorrhagic cystitis in a cynomolgus macaque. And this last set of pictures is depicts the the lesions of SA8, which is a herpes viral infection in baboons. It's analogous to herpes simplex HSV2 in humans. Causes a ulcerative dermatitis in the genitalia. May also cause necrotizing glossitis in the oral cavity. The urinary tract, the lesions of the external genitalia frequently lead to stenosis and subsequent stasis, resulting in lesions like this hemorrhagic cystitis. This is not a primary lesion of SA8 infection. This is a lesion of secondary to SA8 infection. And it may also lead to ascending suppurative pyelonephritis, again, due to the obstruction, the distal obstructions. Reproductive system. This is a normal uterus from a Rhesus macaque. And this is a normal uterus and cervix from a cynomolgus macaque. Cynomolgus have this, have somewhat larger cervices as compared to Rhesus. And this is normal in these animals. This is a squirrel monkey showing the female reproductive tract. This is ovarian hemorrhage. You can also appreciate there's hemorrhage in other areas. This is secondary to Klebsiella pneumoniae septicemia. And the next series of slides are a group of slides depicting endometriosis in the abdominal cavity of Rhesus macaques. Predisposing factors in Rhesus for endometriosis are previous hysterotomies and experimental manipulations within the surgical manipulations within the reproductive tract. The manifestations of endometriosis are typically some degree of the cystic formation on the serosal surfaces of the pelvic cavity and the peritoneal cavity. Again, endometriosis involving the omentum and pelvic canal. Typical deposition of endometrial lesions are generally seen, the primary sites of implantation are the between the uterus and the bladder and the uterus and the colon. And what these cyst formation is absolutely typical. The cysts are then filled with the products of menstruation and it gives the typical chocolate cyst appearance with the degenerating red cells within the cysts. Endometrial tissue and the products of menstruation also have a markedly desmoplastic effect on the surrounding tissues. And so you'll see marked fibrosis associated with it. And again, this is the uterus and an endometrial cyst. You can appreciate the material that accumulates within the cyst. Alternatively, you may just see more acute hemorrhage appearing material, bright red material. And again, this is endometriosis, the uterus and cervix, and the endometrial cyst with this, the endometrial implants encasing the intestinal tract. This is a Rhesus macaque with ovarian endometriosis. This again is endometriosis. Here I think you can appreciate the multiple cystic areas of endometrial implantation. This is a Rhesus macaque. It's fixed tissue, but it's a teratoma in the ovary of a Rhesus. These are relatively uncommon. And this is very uncommon. This is a hemangiosarcoma in the ovary of a owl monkey. This is the ovary, fallopian tube, and fimbria of a Rhesus macaque with a leiomyoma of the oviduct. This next series of slides are all depicting leiomyomas in the uterus of generally macaques. This is analogous to the fibroids in women. They may be, like this one, extend outside of the wall of the uterus. Alternatively, we may see them within, completely contained within the myometrial wall. They are of variable size, normally have this white, somewhat fibrous consistency, and of course they're benign smooth muscle tumors. This is in a colobus monkey, leiomyoma of the uterus. Again, leiomyoma in a baboon. This is a leiomyosarcoma surgical specimen in the uterus of a baboon. And again, this is a leiomyoma in the uterus of a macaque. This is the uterus and cervix with cervical squamous cell carcinoma and a rhesus. This is the primary site of the pulmonary metastases I showed you in the respiratory system. Squamous cell carcinoma, as I said then, is not a common finding, but the two cases I've seen have both resulted in pulmonary metastases. This is one last shot of endometriosis in a Rhesus macaque. Additionally, there's vaginal cornification, which is a common finding in these animals. And in its most severe may resemble this. This is severe vaginal cornification with intravaginal accumulation of the this exudate, the mucosal hyperplasia. These are vaginal calculi. Perhaps the etiology is unknown. They may in fact represent chronic long-standing vaginal cornification. And this is an endometrial polyp in the uterus. Again, an uncommon but finding in Rhesus macaques. Small number of endocrine system lesions. This is papillary adenocarcinoma in the thyroid of a galago. This is focal mineralization in the adrenal. This is a very common incidental finding on histology. Rarely we may see it grossly, as in this case, with these deposits of calcium typically centered at the corticomedullary junction and extending into the medulla. We may see this in animals as young as several days of age with small microscopic calcium deposits in the adrenals. Obviously, on cases like this, it's gritty on a cut section. This is adrenal hemorrhage secondary to septicemia. Variable degrees of hemorrhage, congestion, edema, and hemorrhage and necrosis are associated with septicemia in non-human primates. And this is caseating granulomatous adrenalitis. It's tuberculosis again, Mycobacterium tuberculosis in a cynomolgus macaque with systemic disease. Bones and joints. This is the stifle joint of a juvenile Rhesus macaque. You can appreciate the bulging joint capsule filled with suppurative exudate. This is obviously suppurative arthritis due to Streptococcus pneumoniae, one of the common manifestations of streptococcal infection in macaques. And this is that joint opened up with the suppurative exudate within the joint capsule, joint space. This is granulomatous osteomyelitis due to tuberculosis. This is Pott's disease in the vertebral column. This is the sternum from a macaque with, again, granulomatous osteomyelitis due to tuberculosis. This is the forelimb of a Rhesus macaque exhibiting periosteal hemorrhage at the carpus. This is one of the manifestations of vitamin C deficiency or scurvy. In squirrel monkeys, the classic appearances of pericranial hemorrhage with subsequent hemorrhage, fibrosis, and new bone formation resulting in the lesion of turban head. Rhesus have this periosteal hemorrhage, and also you may see gingival hemorrhage. This is due to their inability to make vitamin C, their dietary requirement for it, and subsequent inability to in collagen formation. This is a langur with rickets. Rickets is a disease of growing animals due to either vitamin D deficiency or phosphorus deficiency, most commonly vitamin D deficiency. This is the classic rachitic rosary with the marked knobbing at the costochondral junction. The defect is the inability to mineralize, to deposit mineral on cartilage and osteoid with continued osteoid formation, but the inability to remodel it. This is the tibia of a young langur with rickets, and again showing the retention of cartilage due to its inability to be mineralized and remodeled. I think you can also appreciate that there's a pathologic fracture here. Typically, rickets is seen in New World monkeys who have a high requirement for vitamin D3, a dietary requirement. The development in langurs was, the etiology was unclear. It may have been due to inadequate sunlight, which is required for the metabolism of vitamin D3. This is the ribs of a squirrel monkey with fibrous osteodystrophy. This is maybe secondary to renal failure or abnormal calcium phosphate ratios in the diet. This is a pathologic fracture in the vertebra of a common marmoset. This is an aged baboon showing marked kyphosis. This is a very common lesion in aged non-human primates, particularly those kept in smaller enclosures. And this shows disc degeneration and osteopenia in the vertebral column of an aged baboon. I think histologically you can appreciate the degree of osteopenia in the vertebral bodies. This is marked scoliosis with degenerative osteoarthritis in the vertebral column of a baboon. The other common lesion seen in generally aged macaques, so it may show up in younger animals, is degenerative osteoarthritis. And the most common site of this lesion is the stifle joints. You can appreciate the early lesions generally show up on the medial and lateral condyles of the femur. Typically, the medial condyle may be more affected more severely. And you can see this severe erosion of the articular cartilage wearing down to subcartilage, the bone underlying the cartilage. Then again, severe erosive arthritis. Another manifestation of this lesion, example of this lesion. This is another of the zebra lesions. This is an enchondroma in the femoral marrow cavity. This appeared in this lesion was noted in an SIV-infected macaque. It's an uncommon lesion, and here's the histologic appearance of the lesion. This is going to nervous system. This is the brain from a Rhesus macaque with cerebral cysticerciasis. These are larval cestodes. This is Rhesus macaque with suppurative meningitis. I have a couple of slides of this because it's a fairly common lesion. And it's secondary to streptococcal pneumonia infection. You can appreciate the degree of congestion in the leptomeningeal artery vasculature, as well as the presence of suppurative exudate, particularly evident on the ventral surface of the brain. Again, this is hemorrhage associated with streptococcal meningitis. These are cerebral abscesses due to Staph aureus. And this is suppurative ventriculitis with the development of hydrocephalus secondary to strep pneumoniae infection. You can appreciate the flocculent nature of the cerebrospinal fluid contained within the lateral ventricles. This again is due to Streptococcus pneumoniae. And again, the suppurative meningitis of streptococcal pneumoniae. This is experimental allergic encephalitis. This is an induced lesion created by inoculation of myelin basic protein. It's used as a model of multiple sclerosis. And it has a variety of manifestations. This is a somewhat more hemorrhagic appearance than is always seen, though hemorrhage is often appreciated histologically. And the periventricular nature of the lesions is fairly common. It also induces demyelination and a suppurative to mononuclear infiltrate, depending on chronicity. And this is a hemorrhagic encephalitis due to cytomegalovirus infection. This is secondary. Clinical disease is dependent on immunosuppression for cytomegalo infection, and this is secondary to SIV. This is severe hydrocephalus hydranencephaly in a Rhesus macaque. This is suppurative otitis and suppurative meningoencephalitis in a baboon. The suppurative otitis extending into the brain is commonly associated with chronic trauma. Intraspecific fighting often results in lesions in the ear and fibrosis of the ear canal with development of abscessation within the ear canal and subsequent extension into the brain because of the fibrosis in the external ear canal. This is another sort of gee whiz lesion. It's unilateral polioencephalomalacia, with loss of the caudate nucleus and the globus pallidus. It is the neuro people the neuroscientists leapt to say that it was an excitotoxic lesion. I suspect that it's actually a vascular lesion. There was no record that this animal had ever been catheterized, but it's likely that this animal had that an attempt had been made to catheterize a branch of the middle cerebral artery, and resulted in a vascular lesion to this, resulting in focal necrosis to these areas. This is again an unusual and induced experimental lesion. This is a fetal macaque. You note that there's lissencephaly, but I included it because it shows cerebellar aplasia, and again it's sort of that training your eyes to look for what's normal and abnormal. This was induced by thalidomide intoxication in the fetus. On the other hand, this is not a diagnostic challenge, but just representation of common lesions that we do see in macaques, subdural hemorrhage secondary to trauma. This, and the hemorrhage is somewhat confusing, is a chronic cerebellar infarct. And I think you can appreciate that there's less tissue. There's malacia here and loss of cerebellar tissue. This is a pituitary adenoma in a Rhesus Macaque. Yeah. This is pituitary adenoma in a Rhesus Macaque. Going to fetal pathology. This is a normal fetus and placenta and fetal membranes from a cynomolgus macaque of 56 days of gestation. You can appreciate that there's a bilobed placenta and the normal fetal membranes. This is placental infarction. This is an example of placental abruption. This is the development of hemorrhage at the periphery of the disc, placental disc. This is a twin pregnancy in baboons. Twin pregnancies are extremely rare in Rhesus also, and it represents a single placenta with 2 umbilical cords. This is a placenta from a Rhesus with suppurative placentitis. A variety group of bacterial agents can be associated with this lesion. Strep is by far the most common one. And this is placental necrosis due to Listeria monocytogenes infection. Listeria has been is frequently associated with abortion in macaques, in ground-raised macaques, particularly on the West Coast in the last few years. It has been associated with particularly cold and wet winters. It obviously is a pathogen that typically resides in the soil. It's cold tolerant, and it shows up primarily in it also coincides with the breeding season, which the breeding season is in the late fall, early winter, so that late gestation falls in the late winter, early spring, when our winters are very cold and wet. We've had a particularly dry and temperate winter this year and haven't seen a single case of listeria yet. This one was from California, which also had a cluster of cases of listeria abortion over the last few years. This is chorioamnionitis. I think you can appreciate the opacity of the fetal membranes here. This is somewhat more normal. Again, this is often associated with streptococcal infection. This is an umbilical cord with a knot. This is a breech presentation with dystocia. Dystocia is a fairly common cause of neonatal death. This is in a baboon. The more common appearance, this is a baboon, and this is again showing the effects of dystocia. This is almost mild in comparison to some of the things we see in rhesus, but with dystocia and the normal vertex presentation, you'll get massive palpebral and facial edema and congestion. This is bronchopneumonia in a fetal lung with Listeria monocytogenes. Typically, the diagnosis of listerial abortion is by culture. It is rare to actually see the classic fetal bronchopneumonia or fetal hepatitis that may be associated with listerial septicemia in the fetus. This is anencephaly. This particular case was experimentally induced. However, it is a rare finding as a spontaneous lesion. We had a small cluster of these cases of hydrocephalus or hydranencephaly over the last year or two in our Rhesus macaques. The cerebral hemispheres are reduced to very thin sac-like remnants. This is that brain removed. There's some postmortem trauma, but these are completely deflated cerebral sacs. Again, this is another case with accumulation of this hemorrhagic material within the cerebrospinal fluid, suggestive of the etiology, which is some in utero insult with massive malacia, necrosis malacia. This is atresia ani in a baboon neonate with the subsequent development of incipient megacolon and imperforate anus. And this is the GI tract dissected out. This is a large cleft palate affecting both the soft palate and the hard palate in a Rhesus macaque. Again, congenital defects are relatively rare in macaques and other species. This is a congenital cleft in the mandible, affecting the tongue, the mandible, and the soft tissues of an infant baboon. This is associated with that cleft palate. This is syndactyly. There were multiple skeletal abnormalities in this animal. This represents the retention of digits 2, 4, and 5. There was also fusion of the ulna with the humerus in this animal. These are the hind limbs from the same animal. This is phocomelia. There's a complete absence of the tibia and fibula. There's a small remnant femur radiographically evident, and then a metatarsus again with reduction of digits. It's 1, 4, and 5 in this case. Clearly, there's a timed insult early in limb genesis in utero. The etiology is unknown. This final section is just sort of going back and reviewing some of the lesions associated with the two common retroviral infections that have clinical manifestations in non-human primates. Specifically, these are diseases seen primarily in macaques. Simian immunodeficiency, of course, is a lentivirus and is naturally found in African macaques without clinical disease. It causes an immunosuppressive disease similar to AIDS in Asian macaques, also baboons, rarely. But most of the work is done in Asian macaques, pigtailed macaques, Rhesus macaques by far being the most common, also in cynos and pigtails. To contrast that, type D retrovirus is a type D oncovirus. There are 5 serotypes. Serotype 1 was originally, probably came from a group of macaques at Yamasee in the southern United States. The original etiology of it is unknown. The original origin of the viral serotype is unknown. Serotype 2 showed up in Celebes macaques in the Oregon Regional Primate Center. It also appears in cynos and is probably the most widespread serotype at this time. Type 3 is the Mason-Pfizer monkey virus. Type 4 is rarely seen, and type 5 is seen in imported Chinese rhesus. This is again the axilla of a macaque infected with SIV. This is severe lymphadenopathy in a macaque infected with SIV. Typically, this lesion of severe lymph node enlargement is found early on in infection, and as infection progresses, it results in depletion of lymph nodes and atrophy. This is fixed tissue showing severe mesenteric lymphadenopathy. Without knowing that it was fixed tissue, obviously the differentials would have to include lymphoma and perhaps tuberculosis. This is a cross-section of spleen showing marked lymphoid hyperplasia, again associated with SIV infection. This is lung, again with SIV infection. This is showing the lesions of SIV giant cell pneumonia. This is one of the primary manifestations of retroviral infection in macaques. Giant cell pneumonia, also a giant cell encephalitis is also seen. It consists of an interstitial pneumonia with large numbers of multinucleated syncytial cells, and viral antigen can be detected within those syncytial cells. Along with giant cell pneumonia, there's it's frequently also associated with a dual infection of pneumocystis carinii, also causing a granulomatous pneumonia. This is an atrioventricular thrombus. It's almost always in the right side. It may be in the right atrium. It may also embolize to the lungs. It is possible to infarct lungs with the size of the emboli that are thrown into the pulmonary circulation. This this is a pulmonary arteriopathy that's been described both in SIV infection and type D infection. You can also appreciate that there's a granulomatous pneumonia here. It's reported that the atrioventricular thrombosis can be associated with this arteriopathy. I have seen the atrioventricular thrombi and pulmonary emboli much more commonly than I've seen any gross lesions of arteriopathy. This is a D viral infection. This is a viremic infant, 9 days of age, with severe necrotizing cheilitis with secondary bacterial infection and ulcerative cheilitis. This is a 9-day-old infant born to a viremic mother. And this is a hepatic abscess caused by Staph aureus. There's a small table in the notes discussing the difference between the common clinical manifestations of type D versus SIV infection. The pyogenic infections are much more commonly associated with D viral infection. D virus infects both B and T lymphocytes and results in anemia and pancytopenia, whereas SIV infection, of course, infects CD4 positive T lymphocytes and has a more selective immunosuppression. So the pyogenic bacterial infections are more frequently associated with type D. This is granulomatous enterocolitis. The etiology is Rhodococcus equi. Again, this is one of the lesions associated with D virus. We see mesenteric enlargement as well as a granulomatous enterocolitis. And again, the granulomatous enteritis with these distinctive hemorrhagic centers due to Rhodococcus equi infection. This is segmental hemorrhagic enteritis. The etiology is cytomegalovirus. And again, this requires clinical cytomegalovirus requires immunosuppression. In this case, it's SIV infection. This is chronic choledoclitis. The etiology is cryptosporidiosis. An alternative differential diagnosis would be enterocolitis Vanuzzi, which is associated with marked hyperplasia and fibrosis in the portal tract. Though it's reported from the New England Primate Center and occurs commonly in their SIV-infected macaques, we are, in our institution, are much more likely to see have never seen enterocytozoan and do commonly see cryptosporidiosis as a causative agent for this lesion. And again, this is chronic biliary hyperplasia and inflammation associated with cryptosporidiosis. This is a somewhat nonspecific finding of mucosal hyperplasia with, I think you can appreciate the thickened rugae. This is nonspecific for SIV. It may also, the lesion of chronic campylobacteriosis in a non-immunosuppressed animal may have a similar appearance. This is granulomatous enteritis, and it's caused by Mycobacterium avium complex. Again, it's associated with SIV infection. And again, this is granulomatous enteritis and lymphadenitis associated with Mycobacterium avium complex infection. Again, in contrast to Mycobacterium tuberculosis, massive numbers of acid-fast bacilli would typically be seen in these lesions. This is granulomatous pneumonia in an SIV-infected macaque, again with Mycobacterium avium complex. This is one of the two manifestations of Pneumocystis carinii pneumonia. This is nodular PCP. It is a less common appearance than the diffuse histiocytic granulomatous pneumonia associated with Pneumocystis infection, which is illustrated here. This is a dual representation of both Pneumocystis carinii pneumonia and the giant cell pneumonia of SIV. So you would see both alveolar histiocytosis and proteinosis associated with pneumocystis, as well as granulomatous and interstitial pneumonia with giant cells associated with a primary retroviral infection. Going to some more a D-virus-associated lesion. This is a retroperitoneal fibromatosis in a Celebes macaque. And this is the intestines and cross-section of a Celebes macaque with retroperitoneal fibromatosis. You can appreciate how the entire tract is encased in this fibrous proliferation. This is the other manifestation of this lesion. This is a subcutaneous fibromatosis or subcutaneous fibrosarcomas. Again, I alluded to earlier, it is thought that that it is a complex of two viral infections that results in this lesion, both type D retroviral infection creating immunosuppression, as well as macaque radenovirus, which is the herpes 8 homologue. This is PML, progressive multifocal leukoencephalopathy. It's associated with SV40 infection in SIV-infected macaques. There's this area of malacia in the white matter. It is not exclusively necessarily a white matter lesion. I think you can also appreciate these areas of translucency and gray matter. It is results from a progressive, and the lesions are progressive demyelination, infection of oligodendroglial cells with SV40 and polyomavirus. This is a more classic representation of Pneumocystis pneumoniae, a histiocytic or granulomatous pneumonia with alveolar proteinosis and the numerous fungal organisms. This is lymphosarcoma. It's typically associated with SIV infection, and in this case it's a segmental lesion in the gut. And again, this is lymphosarcoma in the gut. And these is retroperitoneal fibromatosis. This is the ascites associated with retroperitoneal fibromatosis. This may be quite remarkable in affected animals. Again, retroperitoneal fibromatosis.